Male fetus secrete androgen and the heart rate decreases, while the female fetus secretes estrogen and the heart rate increases. That can predict the gender of the baby. Another interesting video showing the relationship of the fetal heart rate with the gender of the baby. If the fetal heart is less than 140, the gender may be the male one, and if it is more than 140, most of the time the gender is taken as the female. But this is not a perfect rule. There are certain exceptions. Please watch the video till the end. There are a lot of important information regarding the gender determination. Please like the video, share the video, and subscribe the channel. So, this is the pelvic scan of a 36 weeks pregnant lady. You can see the head on the ultrasound, and this head appears to be normal. The bones and the brain matter seems to be okay. The head is in cephalic position. Cephalic position means that the head is facing towards the pelvis of the mother, and most of the time this position result in normal delivery of the lady. She is 36 weeks pregnant and the position is cephalic. That is a good sign. See the cervix, that is about 4.7 centimeter, and there is no issue of incompetence that can result in spontaneous abortion of the fetus. That is again a good sign. Now I will like to locate the heart of the baby in the chest. You can see the four-chambered heart in the chest. Despite that, there is no cord around the neck. This is important to locate whether baby is alive or baby is dead. This is the chest that shows the four-chambered heart. The four-chambered heart is taken as normal heart. This is the abdomen of the baby that also appears to be normal, and you can appreciate the placenta in anterior position. So there are certain exceptions when the heart rate cannot determine the gender of the baby. If the heart rate is increased, that is in infection, in case of anxiety, or increased maternal heart rate may result in increased fetal heart rate. In this scenario, you can't determine the gender exactly, and there are certain conditions when the fetal heart rate decreases, and most of the time it happens when there is cord around the neck, placental insufficiency, or placental abruption, or when there is cord compression during labor pain that result in decrease in heart rate, and there is difficulty to determine the gender with the heart rate. So see the placenta in this case, that is anterior and in fundal position. There is no association of the placenta with the gender of the baby. The baby may be male and the placenta may be anterior or in posterior position. See the thigh bone or the femur bone to determine the age of the baby, and also to see the baby health or weight. In between these two bones, that is thigh bone or femur bone, we would like to see the gender of the baby that appears to be male. See the scrotum, that is very clear. So this is a male baby. That is very interesting. See, in subcontinent, the gender determination for the female is very important. See the four-chambered heart and determine the heart rate that appears to be 160 and the gender is male. So, fetal heart rate may be increased in different conditions. So this formula does not work in every case. There are certain exceptions as discussed in this case that the fetal heart rate is 160 and the gender is male. It is because there may be infection within the female or she may be suffering from the anxiety as well. There may be other signs that can predict the gender. In case of male baby, the face of mother is more bulky and there is more acne on the face of the mother due to the effect of the androgen. And in case of female, the tummy of the mother is more protuberant and in case of male, it is flattened. It is called as tummy sign. There are other confirmatory tests as well as sign. In case of female baby, the mother is more in depression and the color of the urine sometimes can determine the gender as well. In case of female, the urine is more acidic, while in the case of male, it is more alkaline. And with the help of a litmus paper, you can determine the pH of the urine that can help predict the gender. These are the very common tests that you can perform at home, but they are not 100%. Other signs of the gender determination like morning sickness, that is increased vomiting within females in early morning. There is more weight gain due to the increased effect of the estrogen in case of female baby. There is more appetite towards sweet things and the salty thing when there is female baby. In case of male baby, due to fact of the testosterone, the muscle mass is more and the fat is less, so the baby weight is not much more. In case of female baby, there are thin hairs on the face or body of the female. In case of male baby, the hair's growth is dense and thick, and in case of male baby, the female has got more acne on the face due to the effect of the androgens or testosterones. But in case of female, the skin is fair. Thanks for watching this video. Viewers, please like the video, share the video, and please subscribe our channel.